We decided to focus on the consumer assistance programs because they really are the eyes and ears on the ground for the consumer experience. Consumers would call them if they have a problem with their coverage, but they also frequently called the CAPs when they didn't have coverage and wanted to know what their options were. We really found that they were providing a sort of sentinel function, almost the canary in the coal mine, that when problems would start to crop up, CAPs would hear about it, and it's an important resource for state policymakers to understand what's happening on the ground.
The great news that we heard from CAPS is that connecting people with coverage is not a challenge anymore. So some of the big issues that people had in terms of finding affordable coverage, that's really fallen by the wayside for many CAPs. However, there are still a lot of gaps and problems. The number one issue, I would say, is in the states that have not expanded Medicaid. So you still have a lot of low-income people who can't access coverage. Even though deductibles are capped under the Affordable Care Act and people's out-of-pocket costs are capped, many people are still finding cost sharing to be a tough barrier to accessing care. Access to affordable prescription drugs. Many plans have what they call co-insurance, or require people to pay a percentage of the cost of a prescription drug, and that's proving to be a barrier for a number of folks. And then interestingly, we heard, I think maybe this was just one CAP, but I thought it was an interesting comment and perhaps something to just keep an eye on for the future, is concerns about mental health parity, and finding that mental health services were a source of a lot of denied claims. So I think that's just something we're going to want to watch going forward.
Well, it is a new benefit. It'll be interesting. Again, the sentinel function, mental health is one of the benefits that many people picked up because of the EHB, and knowing whether or not people are accessing that coverage will be important.
That's right.
The other thing we heard too, lack of health literacy. Really having sometimes to just explain to people what it means to have a deductible and the premium and the co-insurance, and helping them understand what their benefits cover and how to use them was a big issue.
That's right. And I think CAP spent a lot of time trying to help people understand what their coverage meant and how it works. So they played an important role there as well. So lots of issues to watch, and I'd love to come back a year from now and check back with the CAPs and see how things are evolving. So we hope to do that soon.